Hey everyone, this lesson is on the new coronavirus from Wuhan, China, otherwise known as 2019 nCoV. In this lesson, we're talking about the incubation period for this virus, signs and symptoms, some risk factors. We'll also talk about how we can make the diagnosis of this virus, and we talk about possible treatments and preventative measures. So the 2019 nCoV stands for 2019 novel coronavirus, and this is the virus that was recently discovered in Wuhan, China. It is a beta coronavirus. It's actually the 7th coronavirus found to cause illness in humans. And like other coronaviruses, it can cause respiratory and gastrointestinal infections due to its ability to bind to respiratory and gastrointestinal cells with its viral proteins. And it can lead to a variable clinical picture. It can have variable respiratory and possible gastrointestinal symptoms we talk about in this lesson. So when a patient gets in contact with this virus, there is an incubation period. It takes what we believe to be anywhere from 2 to 14 days following exposure. So after getting exposed to the virus, it takes approximately 2 to 14 days to experience symptoms and become ill with it. And as I mentioned before, it can have a variable clinical presentation. So in some instances, patients can have this virus and be asymptomatic. They can have no symptoms. They can have maybe some mild symptoms, and it can even go up to severe illness and even mortality. And what seems to be the case from what we see in our evidence now is that older individuals, adults greater than 40 to 50 years of age, being male and having pre-existing comorbidities, can be risk factors for contracting this virus and having worse clinical presentation, so more severe illness. So what are some of the common symptoms of having this virus? So there is some evidence that has been shown in the Lancet and other journals that some of the common symptoms include fever. So fever is actually the most common finding we see. So individuals with this virus seem to almost always have fever if they present symptomatically. The next one is cough, and the cough can either be non-productive or productive, which means that there can be sputum or it can be a dry cough. This is the second most common symptom, and it's more often to be a dry cough or non-productive cough than to be a productive cough. So if we see symptoms, those are the two most common symptoms. Another common symptom is shortness of breath. So shortness of breath can be a common symptom as well. Difficulty breathing is another common symptom. We can also see malaise and fatigue. So being very tired, having very little energy can be common symptoms as well. What are some other symptoms, less common symptoms? These include myalgias, so achy muscles. We can also see headaches. These are more rare. We may also see confusion, sore throat, and rhinorrhea or a runny nose. And again, these seem to be less common symptoms. We can also see gastrointestinal symptoms. We mentioned before that coronaviruses can cause gastrointestinal infections, and we can actually see diarrhea and possibly nausea and vomiting with the coronavirus. This is, again, extremely rare. This seems to be 1% or less patients having this. So right now, it seems that the common symptoms I talked about in the previous slide occur in the majority of cases: fever, cough, shortness of breath. So these other symptoms, again, are very rare, especially the gastrointestinal symptoms. And it seems that approximately 20% of individuals who contract this virus have a critical presentation. They become very ill. This can include a very bad pneumonia, renal failure, so kidney failure, acute respiratory distress syndrome or ARDS, and death. And this can occur infrequently, but it can occur in approximately 2 to 3% of cases, and it's normally due to a multiple organ failure. So again, these more critical illnesses and having more symptoms in general seem to occur in older individuals who are particularly male for some reason and who have underlying comorbidities. So those are the risk factors for having a worse presentation. So we're now going to talk about laboratory and imaging findings. So some of the laboratory findings in individuals with this virus include the following: neutrophilia, so increased neutrophil counts; lymphopenia, so decreased lymphocyte counts; thrombocytopenia; transaminitis. So transaminitis is essentially having increased ALT and AST levels. Those are enzymes in the liver. So this seems to cause a little bit of liver injury as well, and increased LDH. Now, with regards to imaging findings, this is a very important one to note. So if we were to take a chest x-ray of an individual who does happen to have this virus and has pneumonia, it seems to majority of the time be bilateral, and this is very uncommon. So it's a bilateral pulmonary infiltrates that are seen on chest x-ray. This is the majority of patients who have 2019 nCoV pneumonia. And if we look at a CT scan, these individuals might have ground glass opacities. And these two seem to be bilateral. So these are occurring in a minority of cases. Again, it's mostly the bilateral pulmonary infiltrates we see. We can see unilateral pulmonary infiltrates, but we can also see ground glass opacities on a CT scan. And with the CT scan, you may also see multilobar consolidations. So here is an image showing bilateral or multilobar consolidations here. So classic finding seems to be bilateral pulmonary infiltrates on imaging with regards to this 2019 nCoV. So how do we make the diagnosis, and are there any possible treatments for this virus? So the way we diagnose it is through detecting the viral genome by real-time qPCR. So this is the way we can detect the virus and make an affirmative diagnosis. Once we make the diagnosis, are there any ways we can treat it? Right now, there are no official treatments available. There has been nothing shown through evidence to say this is a treatment that we can use. So right now we are using supportive care. So giving patients fluids, treating any co-infections or any bacterial co-infections with antibiotics, those types of treatments. So it's more supportive at this point. There is one report from Thailand of physicians using oseltamivir. So oseltamivir is an anti-influenza antiviral, and they used oseltamivir in combination with lopinavir and ritonavir. And they seem to have shown, at least in one patient, that the coronavirus was negative within 48 hours. So this is very anecdotal at this point. It's only one patient, but it's a possible step forward with regards to determining a treatment for this virus. So oseltamivir, again, is an antiviral we use for influenza, and lopinavir and ritonavir are both antivirals that we use to treat HIV. So right now, we're in early stages of determining a treatment, but this may be a right step forward. So how do we prevent getting infected with this virus in the first place? So if we feel that we may have been in contact with someone that is sick, or we've touched something that another person might have touched, or our hands are dirty, we want to wash hands with soap and water for at least 20 seconds. We could use an alcohol-based sanitizer instead if soap and water are unavailable. We want to avoid close contact with sick patients or dead or living animals. So we want to avoid close contact. Close contact is defined as 2 meters or 6 feet, so a 2 meter or 6 feet radius. We also want to avoid travel to affected areas. So any areas that are having any outbreaks of any virus, we want to try to avoid travel to those areas. If you are sick or are ill, possibly with this virus, you want to avoid going to work or workplaces. You want to avoid infecting others. And important as part of all of this is what we call respiratory hygiene. Respiratory hygiene is where we want to avoid touching our mouth, nose, eyes, face if our hands are not washed. So if we have dirty hands, you want to avoid touching your mouth, nose, eyes, and face unless you have already washed your hands. So this is common with all viruses, all illnesses, but this is important for preventing this virus as well. And there's this question of using a face mask. Right now, WHO doesn't seem to highly recommend a face mask. So right now, the WHO is suggesting that you might not need a face mask if you are asymptomatic, you're around other people that are asymptomatic, and you're not in an area where there is a lot of this virus. So it might just be an unneeded financial cost. So we'll kind of keep an eye out for further information on face masks. And if you or someone else is sick and they're coming back from a area that has this viral outbreak, the Centers for Disease Control in the United States suggest quarantine for 14 days. That is the incubation period for this virus. So this is what we're doing right now. So again, if you're arriving from an area of outbreak, and if you are symptomatic or asymptomatic, so they wait to see the incubation period and see if you require quarantine or require treatment. So again, these are the ways to help prevent this new coronavirus. Wash hands with soap and water for at least 20 seconds if your hands are dirty. You can use an alcohol-based sanitizer instead if needed. Avoid close contact with sick individuals. Maintain a approximately 2 meter or 6 feet radius. Avoid travel to affected areas. Avoid school and workplaces if you are sick or ill. And maintain good respiratory hygiene. These methods help prevent all sorts of illnesses, especially respiratory illnesses, not just this new coronavirus. So again, these are methods we can use to help prevent this new coronavirus. In my other lesson on this coronavirus, I talk about the ways that it is transmitted. It's transmitted through several different mechanisms. So please check out that lesson for more information on transmission. And if you want to learn more about other infectious diseases, please check my infectious disease playlist. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel. And as always, thank you so much for watching, and I hope to see you next time.